This program was so impactful for me, professionally and personally. I was able to utilize what I learned through the Defensoras program to create some workflow changes at my clinic that I work at. So I'm super proud of actually taking the things that I learned in Defensoras and making sure that I'm creating that change that I want to stand for. We stand united to make sure that Defensoras and our community are able to understand that those inequities are no longer something that we will be accepting. So please join Defensoras. Hi, my name is Darlene Torres, and I am a graduate of the first cohort of Defensoras through Latinas Contra Cancer.
Hi, my name is Leisha. I saw that the Defensoras program was starting its first cohort, and I was interested in applying because I thought that the advocacy work was amazing. I looked at the website and what Latinas Contra Cancer does, and I was kind of just drawn to the program and what the program was going to do for the community. I think it's so important for Latinas to lead the fight for health justice, because I feel that, especially with my background, I have faced barriers, and I've seen the way that the Latino community has faced barriers in accessing healthcare. We have historically just been underrepresented in research, and there aren't many Latina physicians, and just the way that our community is treated, I just think that it would help build trust to have just more Latina leaders in the field.
Hi, my name is Gloria Pino. I was diagnosed with cancer at the beginning of the COVID. I knew that I had to go on and do things on my own, and I'm so happy that I found the Defensoras, because they helped me navigate through this hard health system that we have, to get the services that I needed to get myself better. Defensoras program is a program to unite the community, to unite and empower women in a positive way.
It's a group of Latina women who have come together and who are very aware of the issues that are impacting our community, primarily Latinos and Latinas. And so the Defensoras gathers a group of these women who have each their own personal story, may have something that they would like to contribute to change a lot of these things that are happening in our healthcare that are just not right, and they need to be changed. As a graduate, I love the fact that we were able to interact with each other. It helped me to dream. It helped me to kind of envision what needs to be done. In my experience, I love the idea of an app that could reach out to the Spanish-speaking community, that could be a source of help for those that don't have answers to a lot of questions that they may be seeking. If you have that passion to change something within the health system, come on board, because we really do need to hear your voice.
The Defensoras program is important for advocacy for your health, patient rights, understanding how the system works, getting a complete and concise outlook of how you can be your own advocate regarding your health. I think the program impacted me with knowledge that I didn't know, what I can do to advocate for myself, learning just the exercise of writing your own patient bill of rights, understanding that, having the doctors in the medical health field understand that and understand you. My mother, who battled cancer and ultimately lost her battle with it, is I guess not being heard as a patient. There's a personalization that sometimes doesn't happen, even with your own doctor, not knowing your needs, not knowing your concerns, maybe not being able to convey them. You can take that right back as a patient, as a woman. You can take your health into your own hands. My name is Danette Green. I'm a graduate of the first Defensoras cohort.
The program is about educating Latinas to be leaders in the community in the context of Latinas Contra Cancer. But obviously you can't look at the issues of cancer without looking at the social economic issues that our community faces, and without looking at the structure that exists in healthcare. And so this ended up being a very personal conversation because many of the women are cancer survivors, but also a conversation that looked at the structure and what is taking place, and kind of how we're really sick because the structure is meant to not keep us healthy. And how can we use the experience of illness to become advocates in our community and make sure we create a better space for the future. I think this cohort was really critical because we were in the middle of a pandemic. And I think what the pandemic did was force us to see what inequality looks like in Silicon Valley. My name is Teresa Castellanos, and I'm a graduate of the first cohort.
The reason it's so huge for me is because when I went through my journey, I went through the doctors so many times and they could never find anything wrong with me until about 1.5 years after my journey. And it's when they found out that I had cancer. So as I was told that I had cancer and I kept going to different doctors and still nothing, and I had to keep pushing and pushing until they finally figured out what was wrong with me. When Darcy came with me with Defensoras, for me it was a big thing because I know how important it is and how we fall in the cracks so many times, because I was the one that had to go out there and push the doctors and keep calling and following up and asking them a lot of questions when they kept telling me that nothing was wrong with me. And also when it comes to insurances, some people they get denied, and because either you make too much or you don't make enough, that when you go to the doctor you don't get the help that you need. One of the most impactful things for me was all the women just wanting to be warriors and fight and make a big huge change. And like we talked about, even if we had to chain ourselves to these fences, that we would actually go out there and do it. I thought that was amazing, because to see women do that and really want to make a big change and be impactful, it's amazing. Hi, I'm Carla Alonso with Defensoras Cohort Number 1.
Latinas Contra Cancer has always been an organization that invests in the leadership of Latinas. And for nearly 20 years, we have been helping the Latino community overcome the obstacles that we face to accessing quality healthcare. Through this cohort, we took the Latina leaders through a whole journey in understanding the healthcare system. We started with a deep dive into healthcare, and the healthcare system in the US was even formed, starting from the 1700s to now. We talked about patient rights and the Patient Bill of Rights. We talked about understanding your health plan, health insurance, how healthcare is funded, understanding in a deep dive into the healthcare delivery system. We talked about our ancestral connection to healthcare justice and Latina leadership in that space. And we talked about how to advocate for yourself and your loved ones within the healthcare system. We saw through this first cohort of Defensoras what we already knew to be true at Latinas Contra Cancer. And that is that the leadership of Latinas, the leadership of Latina patients, the leadership of Latina caregivers, the leadership of Latinas who've had any experience with the healthcare system will change the system, will bring about the health justice that we want to see. All we have to do is hold the space, create the space for Latinas to come together, to share their patient stories, to learn the language of healthcare, and to be given the tools that they need to more effectively advocate. The next step for Defensoras is to graduate this amazing cohort of women into something. The next step for Defensoras is organizing and coming up with advocacy campaigns, policy campaigns that we can win and that we know will create a more just and accessible healthcare system for everybody. We hope you'll join us in the next cohort.